It is now my pleasure to introduce Dr. Jorge Vanegas, the Dean of the College of Architecture, who in turn will introduce our speaker, Dr. John August. Dr. Vanegas.
Thank you. It is always a pleasure to address the participants in this long time series on health. And the best part of that is when I get to introduce great speakers with a great trajectory, and Dr. John August, Dean of the College of Veterinary Medicine and Biological Sciences, is no exception. Dr. John August is a native of Surrey, England, and he received his pre-veterinary education at Eastbourne College in Sussex in England. In 1973, he graduated with honors, not surprising, from the Royal Veterinary College at the University of London and became a member of the Royal College of Veterinary Surgeons. He specializes in small animal internal medicine, internship and residency, and he remained on the faculty at Auburn University as an assistant professor until 1982. When he was at Auburn, he was awarded the Master of Science degree in 1977 and became a diplomat of the American College of Veterinary Internal Medicine with a specialty of internal medicine in 1979. He then joined the faculty of the Virginia Maryland Regional College of Veterinary Medicine as associate professor and coordinator. And he was appointed professor of companion animal medicine in 1986. Then he was professor and head of the Department of Small Animal Medicine and Surgery at Texas A&M University from 1986 to 1997. And he was also deputy dean of the college. So he got his boot camp as dean in our own veterinary medicine college. He is also a recipient of the Texas A&M Association of Former Students Faculty Distinguished Achievement Award in Administration in 1994. He has also served as interim head of Department of Veterinary Pathology. In 2014, he was appointed Associate Dean of Faculties and Director of the Center of Teaching Excellence. And then in 2016, he was appointed Dean of Faculties and Associate Provost. Then in 2019, he assumed the role of Interim Dean for the School of Public Health and the Texas A&M Health Science Center. And now he is Dean of the college. On his free time, you can still hear your voice, John, on the radio, because he also is a lover of music and has a program. So now you can unmute Dr. August, and let's give him an Aggie welcome, a virtual Aggie welcome. So welcome, John.
Thank you, Jorge. I appreciate the kind words, and George, thank you so much for inviting me to participate in this series. It's a privilege. When I first suggested this to George some time ago, I thought it was going to be a nice integrated story and the pieces would all come together very nicely, all the pieces of the jigsaw puzzle. But the more I started working on the presentation, I realized that there were pieces of the jigsaw puzzle under the couch and that I couldn't find. And that really what I'm going to tell you today is a little bit of a disconnected story, but that's because it is such a complicated one. Our world is too complicated to simply be able to put all the pieces together with regard to the interactions of animals and human health. The influences of climate change, human behavior, urban populations, economics, social behaviors, all of those different things make this a very complicated problem. Did you know that there are about 700,000 zoonotic diseases, and that means animal diseases that can be transmitted to people that have yet to be discovered? We're dealing with a pandemic right now of one of them, presumably, but there are about 700,000 more lurking out there somewhere that may or may not cause mischief. And do you know that about 70% of the infectious diseases that we will face in the future will come from animals. So I'm going to sort of tell a story about animals today, and people. I've got lots of pictures. I don't think I've got any bullet point slides except one at the end to show some collaborations. But I just mentioned some percentages, and here's a percentage I want you to remember for my friends in public health. The fact that all of us are sitting here today reasonably healthy and able to enjoy each other's company and be part of this lecture, 80% of the reason that we're here is due to the effects of public health behind the scenes. All of the strategies that have been put into place behind the scenes, that in the way of immunization, sanitation, all of those different things allow us to be here. Only about 20% of the reason that we're here today is a direct result of our visits to our doctors. So I often quote that 80%, recognizing the real importance of public health. And public health has been badly underfunded in our state and our country. And I'm really hoping that 2021 will be the year of public health when it becomes truly recognized for its importance in keeping us all healthy. So my first slide here, actually, I don't usually start out slides with a picture of a dumpster. But I thought I'd show a slide here for many of you who don't know me. My interest over the years, as Jorge mentioned, has been in internal medicine, but it's been particularly in the internal medicine of cats, and most specifically in the infectious diseases of cats. And there are at least 4 cats lurking on this dumpster. As you can tell, my patients are not very good at social distancing, and they are very poorly compliant with wearing masks. But when we see cats in groups like this, there are viruses awash, and I'm going to talk about those viruses a little bit, and that'll lead us into the broader story of the pandemic at the present time. So we're going to talk about some cats today, and we've got some cats on the screen here now who are getting no care at all, but they are shedding viruses. And I'm going to put a cat up on the screen now that is at completely the other end of the spectrum. Her name is Felina. She came to see me some years ago from Houston. She was referred to the small animal teaching hospital. She's a 1-year-old cat, and the owner paid $1,000 for this cat. This is a pixie bob cat. She is a 1-year-old female cat. She doesn't have a tail. You wouldn't really think that she was a $1,000 cat, but she is. And she belongs to the breed called pixie bobs. And she was presented to me with the primary complaints of fever of undetermined origin and lethargy. She didn't want to eat. And when the owner picked her up, she was painful when she was picked up. One of the things about cat medicine is that cats hide their clinical signs very well. And for the very astute of you, and I'm sure Dean Vanegas has picked this up already, if you look at the right eye of Felina here, you can see a very, very small amount of discoloring in her iris. And that told me immediately that she probably had one of a cluster of diseases where inflammation occurs in the eyes. Well, Felina had this particular disease, non-effusive, when we often call that dry, feline infectious peritonitis. One of the most complicated diseases that cats get, and one of the most complicated diseases, in fact, in the world. But its claim to fame is that it is caused by a coronavirus. And when I teach my students about coronavirus diseases, and those, remember back on the cats at the dumpster, probably at least 3/4 of those cats at any given time are shedding coronaviruses in their urine or their feces. So the environment is awash in coronaviruses from cats. The good news is that we don't catch coronaviruses from cats, and it has nothing to do with the present pandemic. But the more I think about Felina and her disease, and this disease is, she has a smoldering form of this disease, which in general is a fatal form of this viral disease that attacks blood vessels throughout the body. And when I think about, try to explain this disease to my students, I always explain to them that this is a disease in which all of the dominoes have to fall. And for Felina, all of them have fallen except for the second one on the right. And when I think more about human coronavirus infections and the pandemic that is happening at the present time, all of the dominoes have to fall in order for someone to end up in ICU on a ventilator. And the dominoes typically indicate the types of resistance that happen, the amount of dose that is present that the cat is exposed to, what the age of the animal is, and what the general body condition is. And there are many extrapolations between Felina, who has sort of a mild but unfortunately fatal form of the disease, where most of the dominoes have dropped, to my next patient, who was unfortunately a young cat as well. This affects young cats typically. And you can see that in this young Persian cat, again, another expensive cat, that his abdomen is very distended, and it's distended full of fluid because of the damage due to the blood vessels and the fluids leaking from the blood vessels into the body cavity. And in this little guy, the last domino has fallen. The good news is that there are some new drugs on the market that seem to be able to reverse many of these signs in these cats. And there are people now that are looking at using clinical trials of these new drugs that are being used for cats to determine whether they may be effective, not only in the laboratory, but in the ICU for people with coronavirus infections. So I've had a long-term interest in cats, long-term interest in coronaviruses. The good news is that we don't seem to transmit, cats don't seem to transmit this particular coronavirus to us, but we're learning quite a lot about coronavirus diseases from our companion animals. And I'm going to lead a rather tortuous story as we move through this. A number of years ago, I had an opportunity to be in the Andes and was at Otavalo, and this wonderful Saturday morning market. And this was a hot day, and as I looked at this woman sort of portioning out chicken with her hands in 80-degree temperatures, I realized that if I had eaten any of that chicken, likelihood would be that I would come down with a very bad case of Salmonella or Campylobacter. And that as human beings, in certain cultures and populations, like the people who live near that market, they have become very used to those organisms, probably have become resistant to them, whereas visitors to those markets, if we were to pick up any of that chicken, even if it was reasonably well cooked, we'd probably have a very severe case of food poisoning. So human beings and bacteria and viruses learn to live with each other as long as they live with each other over time. And the clinical signs that they may get may be very mild. For me, I'm sure it would be very intense diarrhea and stomach cramps if I was to eat any of that chicken. Now this contrasts with this picture here, which is a wildlife market from China. And you can see animals in cages here. This is similar to the wildlife wet market that was in Wuhan in China, where SARS coronavirus 2, the infectious agent of COVID that we're dealing with at the present time, was thought to arise, although none of the animals that were tested in the market were found to have the exact same coronavirus that is there. But this is a wonderful place where this is a wonderful place where pathogens can grow. As you can see here, there's snakes. There are a couple of pangolins in the middle in a cage there. Everybody is stressed. A variety of species are brought together in this particular situation in very unhygienic, unsanitary conditions. It is very stressful for the animals. And as a result of that, they start shedding a lot of viruses that they are harboring. And it's an opportunity for viruses to jump from one species to the next. That's how viruses eventually survive. They find new species, and eventually we may come in contact with those viruses. So this is a very different situation where we have a lot of different species together that are shedding a lot of viruses and mixing together. Interestingly, the source of SARS coronavirus 2, the COVID virus, as of yet has not been found. We'll talk about that in a little while, but clearly these wildlife markets like this are a very, very potent place for the generation of new viruses. We'll talk about that in just a little while. But we do know that with the present coronavirus, that it has passed through bats, and it may well be that there is a bat cave somewhere in China, where the coronavirus first started, but at least at the present time, we don't know the original location of where the coronavirus started. I showed you some pangolins before, and fingers have been pointed at pangolins as the cause of the present outbreak. And we certainly have genetic evidence that the present coronavirus has infected pangolins in the past, but it doesn't appear as though they are the unique causes of or initiators of the present pandemic that we're dealing with. Prime Minister Boris Johnson just recently stirred up a lot of controversy in China, where he claimed that that people who were grinding up the scales of these animals for homeopathic purposes may have inhaled infected scales and initiated the present pandemic. And that caused a lot of political consternation in China. It doesn't appear to be the case, and I don't know where he got that from. Pangolins are the most trafficked animal in the world, and trafficking animals is certainly a very important part of the generation of these new diseases as stressed animals come in contact with human beings. Remember back, there was a severe acute respiratory syndrome called SARS back in the early 2000s that caused a pandemic in China, was eventually traced back to the civet cat, and you see one here in a wildlife market. It took many years to find that infectious organism in that particular case. And in some of these infectious diseases, it can take more than a decade to trace back to the original animal that was the cause of the disease. And if the disease is not widespread in that particular animal population, we may never find the original cause. And remember, I said to begin with that there are probably at least 700,000 infectious diseases in animals that can be transmitted to people that we've not discovered yet. So clearly, bringing animals into close contact like this under stress and allowing them to shed viruses that they share with other species and with human beings is very damaging. I saw a quotation the other day that said, "It's time we stopped using human beings as sentinels for animal diseases." Basically, what they were saying with that quotation was, what we tend to do is just wait until the next outbreak happens or the next pandemic happens. What we need to do is have greater collaboration between wildlife biologists, veterinarians, physicians, public health professionals in being more proactive in identifying the diseases in the wildlife and other populations, rather than simply saying, let's wait until human beings start being infected and then suddenly we have a pandemic. I put pictures of camels up there because we're going to talk about camels in just a little while. They have a very unique role to play, and maybe a more serious role to play at some time in the future as it comes to future outbreaks of coronavirus diseases. And we'll talk about that as we mention a little bit about climate change and environmental change. But not everything is bad about camelids. And llamas are wonderful creatures, and in fact, they produce a special type of antibody that is a very small antibody that is capable of blocking coronaviruses, the entry of coronaviruses into cells. And those very small antibodies are being created artificially presently in the laboratory to determine whether they can be useful in the same way as other antibody treatments are useful in the ICU situation and preventing serious illness from progressing further. So we may well find that our friends, the llamas, can be very useful in this particular situation. We're seeing quite a zoo here today. So this picture looks out of place, but it isn't. And I hope the Dean will remember March 5th, 2020, which was my watershed day for coronavirus. And I think Dean Vanegas and I both had an invitation to spend the day in Kylefield at a legacy event where 700 donors were invited, many of whom were my age or older. And we went through a series of events in the morning, and then we had lunch at large tables, 10 to a table, 700 of us in a large room in Kyle Field. And this was March 3rd, March 5th, recognized the date. I had to leave the lunch a little bit early because I had to go and speak to the provost and persuade the provost that I was not going to allow two groups of study abroad students from the School of Public Health to go to Germany and Panama, even though the university was still allowing them to do so. And as I sat down with Dr. Fierke after lunch, I said, I'm just not going to let them go. And she said, I understand it, but because the university is still allowing it, you're going to have to eat the money. And we ate the money. And 2 days later, the university shut down study abroad. But I went from a room full of 700 people that we think now is almost inconceivable to having to go after lunch to cancel study abroad trips. And so I think that indicates to me the suddenness in which we've had to make changes as we think about coronavirus infections. And I'm sure Jorge will remember that lunch and that day quite well, because suddenly things after that changed dramatically. And
Absolutely, absolutely.
remember that very, very unusual day. And especially for me having to make serious decisions like that after lunch. But very soon after that, and we started realizing that people were becoming sick with coronavirus infections, and the university was starting to shut down for a while and consider how to reopen in a virtual format. Very soon we started hearing sort of talks and reports about the fact that animals were becoming infected. And the first report that we got was from the Bronx Zoo, where a collection of Malaysian tigers went off their food. Some of them started coughing, and some lions at the zoo became affected as well. And eventually it was found that all of the affected animals were infected with the same coronavirus that we get, and it was traced back to an animal keeper at the zoo. So it was suddenly we realized that this might be able to jump species. And then questions arose after that as to whether our domestic species that live with us, remember I'm a cat person, so I don't have cats at home. My wife is allergic to them, but that's been my work at the vet school, has been on cats. And very quickly the question came up as to perhaps if zoo cats can become infected, can our domestic cats become infected? And so very soon after that, well, this was sort of mid-August, and you can't read this, and I don't expect you to read it, but there was an article in the New England Journal of Medicine showing the transmission of the COVID virus, SARS-CoV-2, among domestic cats. Now, recognize that this was an artificial infection in which the cats were infected artificially, and it was shown that they were able to become infected with the virus through nasal inoculation. And then it was shown also that they could transmit the virus between cats that lived in close confinement. And then that started to raise the question as to whether our cats and perhaps our dogs could transmit the virus back to us. And I'm going to finish up by talking about a little bit of great work that's being done at Texas A&M University by some of my colleagues on that particular topic. And then reports started coming around the world that mink were becoming infected. And the problems then became the fact that large numbers of mink became infected in mink farms in the Netherlands and in Denmark and Spain. The mink infections appeared to come from human infections. So it was the keepers of the mink who were apparently causing the problem. But then the problem also became the fact that it appeared as though some of the farm workers on the mink farms developed infections from the mink. And then the problem became worse, that some of the mink escaped. And then there was large culls in each of those countries of large numbers of mink, which sort of complicated then the fact that maybe some species of animals can give the virus back to us. And then a very recent report from the San Diego Zoo reminded us that a colony of gorillas at the San Diego Zoo recently displayed clinical signs of COVID and coughing and mild appetite loss. They are undergoing treatment and appear to be recovering and appear not to have the same severity of clinical signs as people, which reminds us that many wildlife species have this inherent resilience to diseases that we don't as human beings, have resilience to, but it again reminded us that many of our closest relatives in the primates are susceptible to this infection as well. And so the sort of the story continues in this way. So back to camels. And one of the issues about camels is that about 10 years ago, there was a Middle Eastern respiratory syndrome in people that was found to be associated with coronaviruses that were harbored in camels. A serious problem with significant mortality with regard to that disease in people. People were catching this coronavirus infection from camels. The complicating factor of this is that camels can carry this infection for 15 to 20 years during their lifespan, compared to some of the other species that we've been looking at that may live a shorter period of time. The complicating factor as well with camels is that in North Africa and elsewhere, camel farming is replacing cow herding because of prolonged and severe droughts. And so the tendency and the need to herd camels instead of cows is increasing. And unfortunately, the education of the people in that part of the world is not good with regard to pasteurizing camel milk or properly cooking camel meat or close contact with camels and their saliva and their other urine and feces that may be infected with this particular coronavirus. So Middle Eastern respiratory system from camels is one of the main concerns that we will be looking at closely in the future. Climate change is triggering this tendency towards keeping camels rather than cows. And so many things interact as we look at coronaviruses and people. One of the other things that I know is of interest to our colleagues in architecture is deforestation. And deforestation triggers a number of issues. It triggers displacement of wildlife and encroachment of wildlife into urban areas. It tends to create no safe harbors for wildlife. And so one of the things that has been happening is that bats are now living in some parts of the world in urban areas in much greater numbers than they used to. These are fruit bats and are living in colonies in some islands in the Philippines and elsewhere where they would normally live in the forests. The problem with fruit bats is that when they nest and roost in urban areas, they come in close contact with people, with their droppings and elsewhere. They carry a virus called Nipah virus, N-I-P-A-H. Nipah virus has a 75% mortality rate in human beings. These fruit bats are being displaced by deforestation, coming to live in the cities, contaminating the cities, and now we have potentially another problem to worry about. Nipah virus could be the next big one we have to worry about and monitor. And it's going to take wildlife biologists, public health officials, veterinarians, and many others to look at this, and ecologists and others to address this issue. So urban sprawl, and this is obviously something that's of interest to you. I found this picture, and right in the middle of the picture, you may not be able to see it. My cursor is showing, not sure it is, don't think it is, but there's a cow. And as people and animals living closer, and wild animals who are attracted to urban sprawl and attracted to human trash and refuse and other materials, wildlife is attracted into these urban areas and come in more close contact with people, contaminate houses, contaminate sidewalks, may bite, may be adopted. And so we have this encroachment of wildlife. And because of urban sprawl in some parts of the world and the poverty that goes with it, people now have to, and because of the joblessness that goes with it, people may be forced to go into the surrounding areas, the forests and areas, and rather than being able to purchase meat in the markets, may have to go and hunt their own bushmeat. Their own bushmeat may be contaminated with some of these viruses. We have a very complicated wildlife, sociological, pathological problem that is occurring here that is going to take more than one person to address. So, but now let's get down to dogs and cats and look at pets and lockdown and talk a little bit about something closer to home, because there are some interesting stories here as well. In the last year, applications to colleges of veterinary medicine nationwide have gone up about 20%, which is not the same for many of the other health sciences. And it may well be that young people who are interested in the health sciences realize that COVID may be affecting their education and may be affecting significantly how they wish to practice in the future. And so if there's sort of one benefit of this to us in veterinary medicine, it is that COVID appears to be the cause that many more young people are interested in veterinary medicine than they were in the past. And we are the benefactors, or the beneficiaries, I should say, of that. Another benefit of the pandemic is the fact that certainly early on in the pandemic, many animal shelters emptied out as people were looking for companionship and decided to foster or adopt dogs and cats. And so we've had some great benefits as it comes to COVID in many ways. Many veterinarians, in fact, are finding themselves busier now than they were before the pandemic, although their lives are more complicated because of having to do curbside visits and the lack of contact with the human beings as part of the families. Their practices are busier because people are spending more time with their companion animals and are noticing problems that they might not have noticed when they were at work before. So we're going to talk a little bit about pets and lockdown and talk about things. Now, this is my son-in-law who lives in Dallas-Fort Worth. He lives in South Lake and is CFO of a company up there. I asked my daughter to get a picture of this because this ridiculous picture of Sam, who was working at home at the present time with his two Maltese terriers who won't leave his side on the desk in front of him there. It is well recognized that making eye contact with the dog causes the release of the feel-good hormone oxytocin. That's been proven. If you make eye contact with your favorite friend, it will release the feel-good hormone oxytocin. It's also been shown that making eye contact during a break period when you've been working with your favorite pet, whether it's a dog or cat, also leads to a surge in productivity during the next period of work. So there are some real benefits, in fact, to having animals at home, and they really do benefit our workplace at home. One of the major exacerbations of the COVID pandemic is social isolation that is already a serious problem in our senior citizens. Up to 40% of people 60 years or older suffer serious loneliness and social isolation. And we know, and from the good work that is being done by colleagues in the School of Public Health, we know that social isolation and loneliness can inflict feelings that are similar to pain and to other emotional feelings that cause us significant distress. We also know that it can induce the chronic stress from loneliness can induce an inflammatory response. And we know that that inflammatory response can accelerate dementia in some patients. So the added social isolation of the COVID pandemic is exacerbating a serious problem of dementia and mental illness already. We also know that social isolation shortens lifespans. It increases risk of many diseases, including cardiac, respiratory disease, and stroke. So again, the role of animals in providing companionship for people who are lonely has been extraordinary. And I think one of the main benefits, if there are benefits of the COVID pandemic that we'll see afterwards, it will show us and manifest the true role of animals in the mental and physical health of families in this country. And it's something we as veterinarians have talked about for a long time, that animals are members of the family, but the true contributions to mental and physical health, I think, are extraordinarily important. So I've got about sort of 5 more minutes here that I want to talk about. And my picture here is of one of my wonderful clients and a cat named Coco. And Coco passed away long before the COVID pandemic started. So neither Coco nor his owner had anything to do with the present pandemic, but it does remind me of the closeness that people have and the pleasure that they have in their companion animals. And the question I put on the screen, what role, if any, do our pets play in infections at the present time? I mentioned earlier on that experimentally, cats can become infected. And they can transmit it between each other. And of course, the concern then comes with can cats become infected from their owners? And can cats and dogs, I should have said both, subsequently infect other people in the household? But the good news is that we know that cats and dogs have become infected naturally. We'll talk about some experimental studies in just a little while. We know that they have become infected. But to date, there have been no evidence that infections has been passed on to human beings that we're aware of, in the same way that mink closed the loop, got infections from people and passed back infections to people. But there's some interesting studies going on at the present time here at Texas A&M University. And I don't expect you to read this again, but this is a preprint of something that is about to come out, natural SARS-CoV-2 infections, including virus isolation among serially tested cats and dogs in households with confirmed COVID-19 cases in Texas, USA. I'm very proud that the lead author of this study that is being done at the present time is a faculty member in the College of Veterinary Medicine and Biomedical Sciences, but actually we're equally proud that this shows we've got people from AgriLife and I believe wildlife there, and our colleagues at the School of Public Health. And then we have people from the Health Department and CDC and the United States Department of Agriculture who are working on this particular issue. And the very early studies, and you'll excuse me for reading this if I might, that Sarah Hamer and her colleagues have been identifying households in which one or more people are infected with coronavirus. And then with those people's permissions and with all of the appropriate confidentialities, have been allowed to go into the houses and test the companion animals, the cats and dogs in the houses. The initial report that is studied here, and there are now 400 animals that have been studied, but the initial report here included just 17 cats and 59 dogs from these households. And some evidence of infection, not necessarily active infection, but maybe prior infection or residue of the virus, was found in 47% of the cats, nearly half of them from these families, and 15% of the dogs. There's no evidence yet that the animals are passing this back to the people. But this really illustrates the importance of bringing people together, public health specialists, people from county health departments, people from wildlife, people from veterinary medicine, and others have been involved in this project. And I think when larger scale reports are made from this project, it will truly make headlines for Texas A&M University. It just reminds us of the closeness of our interactions with our companion animals. Now I'm going to add one more slide here and hopefully end on a slightly amusing note. There are some countries where lockdowns are more severe than us. And one of them is in Canada, where a recent lockdown in, I believe it's in Quebec, prevented people from going outside, husbands and wives and others and couples going outside together, but they were allowed, one of them, to take their dog on a short walk, quite obviously. And unfortunately, a couple got into trouble because a woman decided to take her husband out for a walk on a leash. And she breached, unfortunately, Quebec's COVID curfew, was arrested, and they were fined $1,200 each for this little escapade when she was found walking her husband down the road on a leash instead of the dog. This has been, George and Jorge, a sort of a circuitous story today. It doesn't all come together nicely, and so it shouldn't. But I wanted to introduce you to the complexity of this interaction between human beings, animals, both companion and wild, and the environment. And it takes a multidisciplinary approach to make a headway on this. We talked a little bit about the cat as an animal model for coronaviruses, but we also, when I first started talking about that initial disease, infectious peritonitis, made sure that the group understood that that coronavirus is not infectious to people and has nothing to do with the present outbreak. But it does remind me that as a veterinarian, I've been dealing with coronaviruses every day in my clinical and scientific career. I'm going to have to sign off at about 5 till to get another lecture kicked off.
Sure.
George and Jorge, I would be very happy to answer any questions that I might.
Dean Vanegas, do you have anything that you would like to say before?
I think that of all the lectures that I have participated in this lecture series, this one was a mix of fascination and things that I had no clue, but at the same time, a little bit of trepidation, because what you open is a Pandora's box that has yet to be completely unleashed. But I think it goes to your point that we just need to be prepared, and we just need to, stop fighting among ourselves on who's right and who's wrong. The reality is that experts like you can tell a very compelling story, and people like us, I mean, you touched on the urban angle, you touched on our style of life, our obsession with pets, our companionship, everything that you have talked about, I think ties together very nicely in the sense that it just reinforces the fact that we're more interconnected and interdependent that the current state of polarization allows us to see. And without that coming together, we're going to face even bigger challenges. So thank you very much, John. This was, wow.
I can just say, wow. I see you have a question from Martha Parker on the chat. Is there any chance of, or do you have to go now?
No, I don't, but I'm in the way that my computer is set up. Let me look.
I can read the question. John.
No, okay, I've got it, I think.
Okay.
Looking here, can you speak to the increase in diversity in the microbiome when we have domestic animals in our household? Maybe a way to increase the effectiveness of human immune systems. So, Martha, and it's great to see you, saw you on the screen earlier. We do know, for example, that children who are raised from a very early age with companion animals have a decreased incidence in childhood of asthma. They are exposed to a broader group of bacteria, proteins from dander, and other substances when exposed to pets than children who are led a much more sheltered and clean lifestyle. I don't know whether it is in fact a microbiome, meaning the bacterial population that is actually shared with the children and colonizes the children, but more likely it is a fact that the transient exposure to the microbiome of animals helps to reinforce and invigorate in an early stage of the child's life a better immune response, so that if they are exposed to those things later on, they have already had that exposure rather than a more exaggerated immune response if they were first exposed perhaps at 5 or 6 or 7 years of age. So we do know that a more robust exposure early on in life is helpful. In general, I think we don't share necessarily a lot of the microbiome of our pets. I think in general, we have our own microbiome in our skin and in our intestinal tracts that is probably 99% our own, and probably little of which is from our pets. But, for example, pathogens in pet saliva that can be particularly harmful to people who have a poor immune system. If I have my spleen removed, or if I have a poor immune system, there are pathogens and bacteria in normal pet saliva that if they lick my face could be fatal. So we have to be particularly careful about, especially adults who may be immunodeficient, in allowing and recommending that, excuse me, that they are licked in the face by their pets. So I'm pretty careful about pet hygiene as it comes to recommendations to people. For most of us, we can get away with it, but there are people who cannot get away with being licked by their pets because of the colonization of their faces with new bacteria. Don't know if that answered your question with regard to that one, Martha, but hopefully a little bit there.
Well,
George, any other questions before we leave this? And hopefully you had a chance to understand the diversity of species and how we encroach on those species and interact with them. And it is true, the next pandemic is waiting to happen. And we have to remember that we as human beings shouldn't be sentinels for animal disease. We have to be much more proactive in getting out there in teams and identifying the next pandemic, waiting for it to happen, whether it's in bats or pangolins or camels or wherever it might be. We need to be much more proactive and in putting into place strategies that will mitigate the chances of the infection coming into the human population. And hopefully public health and other state and federal functions will be much better funded in the future for us to be able to take that proactive approach.
So Don, one question in the
Yeah.
chat, I became very curious about that. And the question says that, you know, what you just said, are there any indications that the animals who were infected carry an antivirus? So you mentioned a lot of animals that get infected, all kinds of things that can happen. Can they be used to find the cure? Can they be used to find the antivirus? How does that work?
Well, I think we're still working on that. We're still working on that. It may well be that for example, the great apes, if more of them do become infected, and hopefully chimpanzees won't be used in research, but if great apes, for example, why are they, as they're so closely related to us, why do they only have a mild disease when many human beings may progress fairly rapidly? I mean, that's a question that I think would certainly be interesting here. I think the perfect animal model for coronavirus disease, Jorge, hasn't been found yet. And that's probably because the natural host probably hasn't been found. It is most likely bats, but we don't know exactly which bat it is and where they came from. But certainly most animals don't have the same severity of disease that human beings have. So understanding how they live in relative harmony with the viruses and do not develop the serious disease that we develop will be important, whether it is in mink or whether it's probably not dogs or cats, because the disease seems to be so mild in those animals. But mink, for example, might be a good animal model in the future, because we do know that they become infected from people, they develop their own disease, and then they produce enough virus that they can infect people back again for the people who are handling them. I'm thinking out aloud here. Every one of these species can have different coronaviruses, or they may have the coronavirus that we're talking about at the present time. The one in camels is different from now. The one in civet cats is different from now. But the rest of the animals I talked about are really the same virus that we're having at the present time that is causing very mild disease in different species. So I think mink may be one of them, and maybe the large apes, that as we study those in the zoos and get to understand their sort of rather attenuated responses, may be of particular interest in how they cope with it and we don't. So with that, in fact, I've got to do a sort of keynote address to another group at 1 o'clock.
Okay, you have to
George,
go.
to do that.
Two people that I'd like to recognize before you leave. Ray Pentecost is the director of our Center for Health Systems and Design, and he's with us. And one of our graduates, Ron Skaggs, is the sponsor or the co-sponsor of the lecture series, but his firm also designed the large animal clinic at your vet school, and the other building, Ron, what was the name of the other building?
You're muted.
You're muted.
I know he needs to go. We did the large animal hospital in the research building adjacent.
Yeah.
Number of
So,
years ago. So but please don't let us make you late, Dr. August.
No, you're not.
let's give Dr. August a big hand as he walks out now or turns us off to go to the next one. Thank you so much.
Well, thank you. I hope I gave you some food for thought and it was a little bit different. Great.
Yeah.
Good. I had fun. Thank you so much for the invitation.
Thank you.